Hello students, we'll go through an important clinical sign which is very commonly asked in the clinical exam and very interesting one. So what this condition is or clinical sign is dry shriveled mummified great toe. What is the line of demarcation? It's a line of final separation between viable and gangrenous part. So what are the types of lines of demarcation? So it's a clear line of demarcation. So line of demarcation is very, very important. Remember, that is in vascular surgery to identify type of tissue separation between the viable tissue and non-viable tissue. There is a very clear line of demarcation. That means the dry gangrene. So it is gangrene will not spread further proximally. Disease progression is contained or controlled. If there is a poor line of demarcation, so that means disease progression can occur proximally, especially in wet gangrene it is seen. So that is infective, more infective, and it may spread proximally more. So there is no clear line of demarcation in that. So this is that is the line of demarcation. It is unclear line of demarcation in wet gangrene with septic separation. This is important. Aseptic separation in the dry gangrene, clear line of demarcation, aseptic separation, and unclear line of demarcation with the septic separation, that is in wet gangrene. So this is important. Clear line, aseptic separation, dry gangrene, unclear line, and septic separation in the wet gangrene. So this point is very, very important. So line of demarcation between the viable and gangrenous part, non-viable part. That is the meaning of line of demarcation. Line of demarcation, how it looks like clinically? Looks like band of hyperemia. And remember, it is often hyperesthetic. If you touch, they will feel pain in that area. Now distal to that, gangrene is painless because it is a dead tissue, whereas proximally pain will be there, ischemic pain, where if the line of demarcation it will be hyperesthetic. So other area which is hyperesthetic is pre-gangrene. There is also, you touch, they will feel pain. Gangrene tissue is not sensitive, whereas line of demarcation is hyperesthetic, remember. So there is a band of hyperemia you can see clinically. So band of hyperemia, hyperesthetic is a clinical sign. Clear line of demarcation says it's a dry gangrene. Unclear line of demarcation says there is a septic separation feature of wet gangrene. Dry gangrene, there is aseptic separation. So basically, line of demarcation means it is line bit for final separation. It is a separation, type of separation it is. Actually, it's a type of separation, type of final separation between viable and non-viable tissue. That is what exactly you have to remember. Type of separation, final type of separation between viable and non-viable tissue is line of demarcation. That is the meaning which you have to remember. Very important clinical entity in gangrene patients as such. So for in detail examination of all these patients in vascular disease, arterial disease, you can go through my SRB clinical methods in surgery, and treatment test aspect you can go through my SRB manual of surgery, operative procedures of different vascular surgery and amputations. You can go through in detail about my operative surgery book, and tissue approximation for skill, and all lectures in detail is there about as far as CBM syllabus is concerned, A to Z surgery, including specialty, urology, cardiothoracic, neurosurgery, operative surgery, X-rays, instrument, specimens, everything is there in my DigiNow lectures. You can purchase for a year through JP Publishers. I hope you understood the line of demarcation meaning and its importance in a vascular surgery today. Thank you very much.